we shall speak a few things about how to maintain our urinary health. A common question which our patients in our OPD comes accompanied by relatives. The relatives ask, "Sir, what can I do about my maintaining a proper urinary health?" Then the most important thing which I tell them is about fluid intake. Now, the function of the kidney is to throw out wastes out of the body. Now, this is thrown out by means of urine. The adequate urine output is very important to throw out waste from the body. It is usually seen that for adult, if we pass around 2 liters of urine per day, we are able to excrete our waste properly. So that is forms the basis of how much fluid we can take. Now, if I do not have a heart disease or a liver disease in which fluids are restricted, if I take around 3 liters of fluid, I don't mean water, I mean fluid, that is liquid, then I should be passing around 2 liters of urine. Why? 3 minus 2, that is around 800 to 1000 is lost in our breath and from perspiration from the skin. So only if you take 3000 ml of fluid, we will pass 2000 ml of urine. So this is the first part. Now this 3000 ml of the fluid, we should know that around 500-600 just comes from our diet. Like we are having dal, we are having dahi, we are having chawal, we are having salad, everything has a lot of amount of water. Another 500 may come, so if you take 2 or 3 cups of tea or coffee, maybe it is just 150 into 3 or 2, it's just 300 to 400 ml. So if you drink around 1.5 liter of water, another say 500 ml will come from our beverages, another 500 will come from our food, 500 to 800. So usually we have sufficient fluid intake to produce pale yellow urine. So a good guide to how much fluid to drink is to pass urine every 3 hourly. We should know that we should pass urine every 3 hourly. We should not retain more. We should not hold long. And in this 3 hourly urine, if the color of urine is pale yellow, it means that we are drinking enough. If the color of urine is dark yellow, that means we are drinking less. If the color of urine is very watery, then we are drinking too much. So we'll go to the loo very frequently. So a good guide to have a fluid intake is to maintain a pale yellow, that is a straw colored urine, जो कच्चे बांस का रंग होता है, straw colored urine every 3 hourly. If you can achieving that, that means our fluid intake is adequate. We don't have to get up in the morning and take 2 liters and then don't drink the whole day. These are not, I don't think, are ideal situations. In the daytime, we should take enough fluid that we should be able to pass urine around 3 hours, 5 or 6 times urine hona chahiye. Now, what about the night? In the night, if you take a lot of fluid in the evening, men or women, especially elderly, may have to get up again and again in the night. So it is very preferable that we stop liquids 2 hours before going to sleep. So someone who sleeps at 11 should ideally have his or her dinner by 8:30, medicines his or her by 8:30, so that he get a 2.5 hour window for the kidney to form urine, empty the bladder, go to sleep at 11, don't have to get up at the night. So these are very important advices to how much fluid to take, when to pass urine, which is every 3 hourly, when to stop fluid 2 hours before going to sleep, pass urine and go to sleep, so that you don't have to get up again and again in the night. And fourth thing is that if you are having cardiac disease, if you are having liver disease like cirrhosis, you should ask your physician how much fluid you can take. In all other cases, you drink enough to produce pale yellow urine. That's the mantra. So if you are in Chennai or Calcutta, you may require 5 liters. If you are traveling in a suburban train in Mumbai, you may require 5 liters, and 2 liters may not be enough. If you are in air conditioned room, a 2 liters is good enough. You don't have to take 5 liters. If you take a 4 liter fluid for it in an air conditioned room, so with your diet, beverages, everything, you will end up taking a lot of fluid. You will go again and again. You will sit in the loo. So it's a very important part of our fluid intake. For example, again, some specific question like people who are in sports. As I said, you should be passing pale yellow urine 3 hourly. Now, you can gradually make out how much water is required to pass urine 3 hourly. So, if you go to pass urine every 3 hourly by using a timer in your, for example, you passed at 6 o'clock. Go at 9 o'clock, pass urine, you see the color of your urine. If the color of urine dark yellow increase, you have drank 2 glasses, make it 3 glasses. Now, there is nothing fixed. Depends on how vigorous the sports you are doing. You are doing a simple yoga, maybe you will not require much fluid, but if you are doing a heavy gym, maybe you will lose a lot per sweat and you will require a lot of fluid. So, fluid intake is not fixed. This is the bottom line. The fluid intake is not fixed. You should have enough so as to pass pale yellow urine every 3 hourly. Whatever is required to achieve that, you do that. But then ideally, if you take 10 to 12 glasses of water a day for somebody who is sedentary in air conditioned room or in a good climate, it is good enough. So if you're taking a 200 ml glass, 10 glasses, 2 liters. So that's what your fluid intake should be. But if your urine is dark, please increase it. If your urine is very watery, please decrease it. That's the way you should adjust it yourself. There's no फिक्स्ड मंत्रा और फिक्स्ड फार्मूला दैट आपको इतना जो मुझे चाहिए वो शायद आपको अलग चाहिए होगा. जो पर्सन फॉर एग्जांपल हु इज डूइंग वेरी हार्ड वर्क लाइक हु इज lifting weights or who is doing loading a truck, he will require much more fluid. A sportsman who is there in the doing a lot of sporting activity for 6 hours 7 hours a day will require much more fluid. So these are all different variations of fluid, but this is the way how which we can understand how much to take. Simple thing, pass urine 3 hourly, look at the color of urine. Dark, increase. If it is watery, decrease. If it is pale yellow, you are having enough. Thank you.